I'm going to talk to you ladies about what you can do to feel better. Let's talk about the hip. The greatest question I get asked is my hip pain, what can I do? Is your hip stiff or is it hypermobile and you feel like it's popping out of place? Because both things can cause lots of problems. Let's go with number one. It's stiff and you have limited range of motion. Your femur comes up into your acetabulum, and sometimes with wear and tear, your acetabulum can have some bony growths. So maybe you have what we would call like a cam deformity, and the acetabulum is like chomping down on your femur. Now that's a bony change. So when that stuff happens due to aging and wear and sports, we need to be nice to your hip. We need to maintain that mobility. We need to maintain the strength, but you need to do something different in your everyday life to change the pain. We need to change how we load it. That can look like stop crossing your legs. Don't jump on one leg. Maybe a certain exercise you're doing is exacerbating your symptoms. So stay out of its way if something you're doing is hurting it and is loading it. Number two thing you can do is let's look at the range. I oftentimes talk about something called hip CARS, which is a controlled articular rotation, where we're moving your femur all the way through the range. All joints have a range of motion, and we want to maintain the best range of motion we can with the hip. Sometimes the bony changes do give us abnormal range of motion, and sometimes it's going to be limited for the rest of our life. But I want to save what you have. So sometimes doing something called hip CARS could be helpful, and I'll show you. We can also do stretching to maintain better pliability of the muscles surrounding the hip. Oftentimes people talk about the piriformis, but it's not the only one. There are other nearby rotators of the hip. But sometimes our hip has an imbalance because we have significant weakness in our glute max, which is on the back, and our glute med, which is on the side. Sometimes we also have weakness in the front on the iliopsoas. So sometimes with my patients, we do mobility, we strengthen, we stretch, and then we change the mechanics in our everyday life. Also, stop hanging out on that one hip that hurts, because when you're popping that hip out and standing on one leg all the time, it's not doing you any favors. Now, the other thing that can happen is my people, let's say they have EDS or labral tears, they feel so loose and they feel like everything's gonna pop them out. Well, these people may do CARS as well, but maybe they stay in a smaller range because maybe they have huge range, but now we're trying to control them through the range. And so they are doing strengthening. Now, sometimes in the beginning, they can't handle doing the strengthening because they can't handle weight bearing. So we do non-weight bearing, gravity eliminated. And as they get better, we increase resistance to increase strength and build the muscles surrounding the hip. Specifically, the glute med, the glute max, we care about the adductors, we care about the hamstrings, and we also care about your hip flexors. But strengthening all the muscles surrounding is a good choice. With these patients, they may say they feel like they need to stretch and they just need to pop it. Listen, a stiff joint never says, I feel like I need to pop it. If you say you feel like you need to pop that hip is not stiff. But if you really want to figure out how to help your joint pain, I suggest seeing a physical therapist and having an assessment and letting them diagnose you with whatever dysfunction is happening and making you a prescription exercise program. It's really a big deal. And with my patients, sometimes they're really surprised that they have an unstable hip versus a stiff hip. And sometimes my patients with EDS, they have many joints that are hurting them, and we have to work on many different things at the same time, and we have to make a whole program for the body. And that is okay because they do so much better when they have a routine. So your joint pain relief can come through exercise, but which one? And it depends. Are you stiff? Are you hypermobile? Are you a combo? But if you can find a physical therapist, it would be amazing.